Thank you. As already introduced, my name is Emmanuel Jonah, Senior Communication Officer, Ministry of Health. Good morning, ladies and gentlemen. I'm Dr. Gilbert Laseta, State of Kabale.
Good morning, everyone. I am also Rukana Samuel. Like I was introduced earlier, I am a program officer in the Federal Unit.
Good morning. Julie Tonjero is my name, Communication Officer in Hotel. Good to be here.
Thank you, everyone. Thank you, everyone.
My name is Philip Katawarwa, and I'm from the Department of Health Promotion, as earlier introduced. I'm going to dive straight into what brought us here. But before I do that, your team shied away from the mic, but you do need to introduce yourself. Bob, you can speak louder.
Good morning, everyone. My name is
We have not heard.
Harvey.
Speak like you're speaking on a radio station.
Good morning, everyone. My name is William Rose, and I'm also part of the SPO.
Okay.
Good morning, everyone. My name is Joseph. Solution for People. Thank you.
My name is Paul Passenger, also from Solutions for People. As you do the exam, please click on pretest. There's pretest post, there's a pretest and a post-test after the session. So those who are doing the exam, please go back up on pretest. Click on pretest. So you shall pause. Those who are doing the pretest. Will it go back to you?
Yep.
So from the Ministry of Health, one of our key stakeholders, especially in public health response, is the media. And that is why you are key people that we have to engage always every hour. Why? Because you can reach as many people that we cannot reach on any platform. You have the platform and you are the way for us to reach the people. You contextualize the messages that we give you, put them in the local languages, and people can actually listen to you. I just want to play a short video on public health emergencies, or what we call global health security. Global health security briefly looks at how can we notice, or how can we notice and report diseases within our communities. So this is a short video.
Could be. Next week.
So the Bluetooth connection is being a little bit funny. The guy who is mowing the lawn outside, I don't know if we are using this. Sorry? The hotel.
Your vigilance could be key in preventing the next major disease outbreak. Here are some important signs of human, animal, and environmental health that you should be on the lookout for. Unexpected bleeding from any part of the body in a person at any age. Anyone with fever and rash. Unusually high number of people from the same location buying drugs for the same illness from a drug shop. A cluster of animal deaths. Unusual numbers of children absent from the same school or class due to same illness. Unusual change in physical water quality parameters of drinking water sources, for example, color, taste, odor, suspended solid, and turbidity. If you have seen any of these signs or any public health emergencies, please send a text message to 6767. Staying vigilant and monitoring these signals, we can help prevent public health outbreaks. Early detection is key to protecting a healthy community.
Okay, so that's just a brief video and about reporting of any disease within your community. So I was as well tasked to give a brief update on on how the situation is in Uganda, but also what we've been able to do from the time of the declaration. This slide right here shows, so the upper bit is what the international community did, or what is being done in the DRC. Down is what Uganda has done so far. This is the timeline, at least as up to the 8th of July. So the declaration for Uganda was made on which day? Which date? You don't know, you don't remember. So the declaration, Uganda made the declaration of the outbreak on the 15th of May. But before that, there were incidents that happened. Between the 11th and the 15th, we had a Congolese national, or actually there were a couple, 3 of them. Congolese nationals coming to Uganda for medical assistance, for medical care. One of them passed away, and that is the case that you heard about that passed away. He wasn't feeling well. He comes from the DRC, passes over the Albertine through Chukube directly to Kabale. And we picked up this particular case from Chibuli Hospital. The other, who is what we call a probable, and I'll explain what a probable is, what a suspect is, and who is a confirmed case. The other had come 4. Samples were taken off all these people, and They were later confirmed. So on the 15th, the samples were taken off before, but on the 15th is when we got the confirmation of the outbreak. And that's when Uganda declared. I don't want to dwell so much on what the international community did. That's mostly the DRC. I want to focus more on what Uganda did. Then on the 19th, remember we were preparing for Mother's Day, which was just, some people had already started trekking Kabale, Otnam, that Mother's Day celebrations will be conducted from people's homes, not walking all the way to Namgongo. The 21st of May, all flights, borders were closed. Between the 21st and the 25th. 27th, the border was closed for 4 days. The first presidential address was done on the outbreak on the 10th of July. On the 11th, there was a mandatory traveler health declaration. If you try to travel out of the country, you know there is a form that you fill. You declare where have you been, how are you feeling? Why? Because it becomes an outbreak like Ebola or a disease like Ebola. It's what we call a public health emergency of international concern. It can spread so fast, it can kill a big number of people. On the 22nd of June, a team consisting of also our very own Television-Uganda managed to sign an MOU that was between the Ministry of Uganda or the government of Uganda together with the government of the DRC, sign an MOU for Uganda to be able to also support the DRC in terms of management of their cases. Between the 25th and the 27th, Uganda hosted a preparedness meeting, and this brought together all health stakeholders from the DRC, the ministers, and other technocrats from the DRC to Uganda. This meeting was held in Nodo. On the 8th of July, we conducted what we call an early action review. An early action review checks to see what the nation has done within the first 7 days of the response. Within the first 7 days of the response, how and what did you put? The quick look has managed to do. We have so far had 20 confirmed cases. 15 of them people from the year who traveled for medical care. What contributed to the 15 coming? We talked about the 3, we had another case, and around 28 we got another case. What contributed to it? One of the first cases, the one who didn't pass away, one of them was taken into treatment. She was a lady, and she was attended to, she felt better, and she asks for Wi-Fi, they give her Wi-Fi to be able to talk to her family. She just tells them, guys, whatever you are doing, whether you do what or what, make sure you come to Uganda, they have the medicine. That in Uganda, we have, just to clarify, there is no particular medicine for Ebola. It is not there. The same way how you see we have anti-malarials, we don't have a medicine that cures Ebola. What we do is we provide supportive treatment to your body. That we basically boost your immunity to be able to fight off an infection. 5 Ugandans, of the 5, they were attributed to or linked to the cases that had come. The 4 were health workers who attended to the patient. The 1 is that taxi driver who moved the person from Chikube all the way to Kampala. And then it took back a little bit to Chikure and it crossed to the DRC for burial. So cumulatively, we've had 836 contacts. Contacts means if I have the infection, or if I am sick, and you get in touch with me, you have been with me, you have taken care of me, you are a contact. You are a contact. You have been in my space. You are a contact. Into that if I get, okay, let me not use you. If me, I'm the one who is sick, and you get in touch with me, or you come clean my vomit, you come and, what is it called? Take a picture. When someone puts that you were new and whatnot because you have a high fever, all that, if you have been in touch with me, you, remember, are a suspect. But between 0 to 2 days, you may show signs. Now, this is the funny bit, is that our bodies are different. Our bodies are different. Someone may see him and they say, Gomshija no man. And they look at, let's say, my brother there, he will not be offended. And they will say, Kayan Kazakufa. Surprisingly, the other one has a stronger immunity than him. So, within 2 days, he may start showing signs. And by signs, I mean he just gets like a headache, all of a sudden he's feeling nauseated. He may start showing signs. And by signs, I mean he just gets like a headache, all of a sudden he's feeling nauseated, and he has a temperature. Immediately, he becomes a suspect. So anybody who has been in contact with me, who has had the infection or who has had the disease, anybody who has been in contact is monitored for 21 days. So there is what we call the primary contact and the secondary contact. You may get in touch with me, but you meet also another colleague of yours, another person. So that person becomes a secondary contact. Yes? We monitor you for 21 days because within 21 days, this disease can show. And after 21 days, if you don't show any signs or symptoms, it probably means you didn't pick up the infection. If you look at the cases that we had again, I talked about the 15 people who came from the DRC. 13 were business people, so they had a bit of money. They could access, the premier medical services of Uganda within the private sector. If you look at the caliber of hospitals they went to, is what some Ugandans cannot really afford. So they were affluent Congolese who were able to seek care in. I request that I skip this particular one, but anyway. 100% of the cases were investigated, contacts listed. We did genomic sequencing. Genomic sequencing basically looks at what pathogen is this, to validate epidemiology, but also being able to link these people to where they come from, that there is an outbreak in that particular village. That's what we did. After building surveillance capacity through long-term workforce development, of course, we have advanced tracking systems, intermediate tracking, frontline tracking, rapid deployment of teams, but also a strong linkage between laboratory and surveillance. If there is anything Uganda can take pride in, is that we know how to manage our, and we have built enough capacity to actually even support other countries. If you remember very well, for some of you who used to follow the news, in 2008, West Africa had the biggest Ebola outbreak. It lasted 2 years. in 2 years, 20,000 people, more than 20,000 people actually got infected. Guess who they came to ask about that matter of the outbreak? Uganda. Like we say, majority of our cases were imported. For some people, they wanted us to report the fact that this was not a Ugandan problem. It was a Congolese problem that was imported to us. Unfortunately, as long as the person is picked up from your health system, it is a problem. So this basically breaks down what they were doing and we profile everything. Who is this person? What do they do? What age group are they? How old are they? Is it a male or female? You get all this data. This basically breaks down. It provides a number of how many people in this particular age group, and that there we know their what is their occupation. If we look at the signs and symptoms of Ebola, for example, give me one. It is simple. Nose bleeding, a fever, headache, stomach ache, vomiting, any other? Yeah, there's still somebody. It's okay. So, if we look at the signs of the early onset of symptoms in Ebola, it is the same as all these. And these are very common. We have malaria, typhoid, if you have a typhoid fever, bacterial sepsis, as well as sepsis just means infection. So you see that the person may have headache, fever, muscle pain, joint pain, fatigue, and this is common in all those. And that is why the health system has done a lot in terms of making sure that the health workers understand that you have to protect yourself. And even you, gentlemen, as journalists and communications professionals, whereas you want to break the news and you want to be the first to give the news, remember that your life has no spare. Your life has no spare. So, as you can report on something, don't touch. Don't touch, let's say, a person who is not feeling well. If you are, no, don't touch. For the health workers, the DHO emphasizes it. You have to put on appropriate PPE. We've had cases of when we talk to our friends, the VHTs, someone says, "Me, I need gloves," and then you ask the VHT, "What are you going to do with the gloves?" Says, "You know me, I tell to people, so I tell them every time, do not touch anyone. Refer them, let them go to the facility. And in case you are so worried, you can always notify the DHO of your district." I believe as journalists, you have the contacts of this people. There is the district surveillance focal person, you must know these people. District surveillance focal person, there is the lab technologist, district lab focal person, the DHO. You can let him know in case of an outbreak of any disease. For example, you may be in your village, you have gone to pick up a stone in the village, and somebody is saying there is an infection. People here are over-diureting. Yeah? And we've lost, let's say, like 2 people. And people here, they have temperature, but they're also diuretic. For you, those are the 2 symptoms you've heard about. Yes, break the news by the way. Inform the DHO immediately. Why? Because whereas you're breaking the news, you also have a role to be able to contribute to the safety of each and every Ugandan. Locally, we've not had a lot of transmission. Like I mentioned, 4 cases of workers. One was a taxi driver. We didn't have a lot of local transmission. And this is because all high-risk conducts were institutionally quarantined. We put them in hotels and we monitor them every day. In case anybody doesn't feel well. The low risk, those who are like third, after primary, secondary, the third person that you may think may be infected, those who are monitored from home, but still, they were monitored. So we are 100% followed up on all our cases. This is basically the movement of people and how majority of the cases made it to Uganda. Majority of them passed through West Nile. Majority of them passed through West Nile. Arua, we actually had a very interesting case of somebody who chartered a flight from the DRC to Arua, and then from Arua to Entebbe, straight to Entebbe regional referral. Because, like I mentioned, somebody had said Uganda has the medicine. So people were going to come to Uganda no matter what. No matter the direction they have to take, they were coming. We closed our border with the DRC. Some people decided to pass through Rwanda. And when they passed through Rwanda, where did they pass? Ochang. Yeah? Some pass through Miramari.
Even porous borders.
Yeah?
Even porous.
Even the porous borders. They will still come. There are others that pass through Tanzania. So that they pass in Chotera and they come. But for the 15 cases, majority of them came through. 12 of the 15 passed through here. Then the gentleman who passed away passed through school. So if you look at also the second map, it shows where at that time where infections were. This is the Ituri province. And this is where mostly the cases were. I request that I move to the next. So what is the objective of this meeting? It's basically for us to It's basically for us to understand the importance of communication during outbreaks. As Uganda, we've done a very good job. And we cannot say, as the government, we've done a good job without saying even the media has contributed to this. That's why you are key stakeholders to understand the role of the media in the Ebola response, but also to promote this communication for people to understand that it is not very far. You know how people always say, if a disease is in the, let's say, Kampala, they will say, our Kampala. Yeah? But remember, you have a relative in Kampala who is going to come and do what? Visit. You may think that the DRC is very far, but we are hustlers as Ugandans. Somebody has gone to pick wood or deal in gold in the DRC, but they come back because Kampala comes to your particular area. So the movement of people is free and we cannot stop it. However, can people understand? And that's why when we have an outbreak, we don't just communicate to a particular region. We communicate to the whole country. Can people understand the risk and also what are the recommended behaviors that they can take up? But also to strengthen the collaboration between the Ministry of Health and the media fraternity. So what is Ebola? In your own words, you leave alone that one. In your own words, if they told you what is Ebola? It is a dangerous disease caused by a virus. Yes, you're perfectly right. Yes, my brother, for you, what would you say?
disease that kills people, yes. For you,
It's a disease that has no cure.
problem.
So the Ebola virus is a very severe and deadly illness caused, the Ebola virus disease. You know, usually we say Ebola, 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 so but some of us know the virus. So the Ebola virus disease is a severe and deadly illness caused by the Ebola virus. This interest, let me actually give you a bite that was done by somebody in the media that pretty much sums up what I want to say.
Ebola, on average, kills 5 out of 10 people it infects. In its deadliest form, it can kill 90% of its victims. But how did it come to Uganda? We go back to 1976. In Sudan, the now South Sudan, in Zara, a cotton factory worker fell ill on June 27. The symptoms, high fever, muscle pain, and by day 5, he was bleeding from the nose and the mouth. 4 days later, he was dead. 3 men followed him, colleagues, family. 2 died. Nobody knew what they were dealing with. In Zaire, across the border, now the DRC, a school teacher named Magalo Lokela got sick. The virus spread through a mission hospital where needles were reused and protective equipment didn't exist. Reused needles became vectors of death. By the time it burned itself out, 318 people were infected, 280 people were dead, and 88% fertility rate. The world had never seen anything like it. But where did it come from? Scientists believe the virus lives in animals, bats likely, primates, deep in the African forest. When humans hunt, butcher, handle carcasses, the virus crosses over. This was not an accident, it was inevitable. After the 1976, Ebola did disappear. It smoldered, small outbreaks in Central Africa, Sudan, Gabon, and the DRC. The virus remained in the animals. The world moved on. But in Uganda, in the year 2000, Ebola announced its arrival in ways that would change everything. October 8, 2000, Gulu district, northern Uganda to be precise, an unusual fever. A superintendent at St. Mary's Hospital sounded the alarm. 1 week later, confirmed, Ebola virus, Uganda's first recorded cases. By October 16th, there was Road Obilo village, 14 kilometers from Gulu town. From there, it spread into hospitals, homes, and communities. One man saw the danger immediately. Dr. Matthew Rukwia, a superintendent of Lahore Hospital, he organized his staff, set up isolation units, became the calm center in a climate of hysteria. By November, cases jumped to 262. The virus spread south, 614 kilometers from Barara. At the height of the outbreak, Dr. Rukwia refused to give up the fight. He paid the ultimate price. 2 months later, he was dead, exposed in the isolation unit. The fever took him the way it took hundreds of others. And by the end of the outbreak, Uganda recorded 24 deaths, a 52% fatality rate. This was not the last of them. Uganda has faced 8 Ebola outbreaks since 2000. We've had Ebola Sudan, Ebola Zaire, and now Ebola Bugi-Bujo. The virus returned in 2007, 2011, twice in 2012, in 2019, 2022, 2024, and now it's back in 2026. Each time, the same question: how do we survive? This happened in 2000. It's happening now in 2020. The difference between survival and loss is speed and protocol. Follow Ministry of Health guidelines. Practice regular hand washing and maintain proper hygiene. Avoid contact with body fluids such as blood, sweat, urine, and saliva. Seek immediate attention if you develop Ebola-like symptoms: headache, fever, abdominal pain, muscle pain, diarrhea, and vomiting. If you see signs of Ebola, report immediately to authorities. Don't be silent.
A round of applause for that gentleman. I couldn't find a better video that would show the power. Do you really think that through a press statement given by Television-Uganda, he can reach everyone that the way that gentleman reached? Are you sure? Through a press statement given by Television or the PS of Ministry of Health, you can reach people and explain to people that because you put it to be personal, you put an emotion to it. Why? Because you are concerned for the rest of the Ugandans. And that is the power of the media. Thank you very much. Now let me go back to my slides. So he has pretty much summed up what is Ebola, the history of Ebola, the strains, yeah, how it is spread, but also the prevention measures. How it's spread, body fluids, including any fluid that comes out of the body. Saliva, sweat, vomit, diarrhea, urine, breast milk, semen, and blood. And that is why for as long as a man has been treated for Ebola, he is still recommended to have protected sex for the next 6 months. Yeah. You have protected sex for the next 6 months. Why? Your semen can become a repository. And it remains there. So for the next 6 months, but you still have to out it. That's why we recommend that for as long as the person has been in the treatment unit or the Ebola treatment unit and he has tested positive, we give them condom as a man. For the women, not so much. So breast milk can also spread it to your child. Contaminated items including beddings. For example, if I have a very high fever, remember I'm going to sweat. So the beddings that I'm on do what? Have the virus. So anyone who also gets in contact with those also picks up the disease. The signs and symptoms, we talked about a fever, severe headache, nausea, vomiting, diarrhea, coughing, chest pain. Now these are the very last ones, the bleeding and the red eyes. And the red eyes also comes because at that time, some of the veins within your body are also busted. And at this level is where we do not want the person to reach. Because once you reach this level of bleeding, blood coming out of your body, the chances of recovery are close to zero. So, not every patient develops bleeding. In this particular strain of Ebola, not everyone has bleeding. And that's why when it was in Bundibujo, it was a problem. Because everybody was waiting for the bleeding. They thought, this one just has malaria. Everybody was waiting for the bleeding to confirm. And that was at community level. That's why we had a very high fatality rate during the outbreak in Bundibujo. So, the key message is that communication saves lives. During outbreaks, people make decisions based on information they receive. Some people are going to first refuse it, another one is going to explain it to him better. Or don't some of you call you and don't some people call you from the public and they say, we had you on the news, but what did you say about this? Is it true? I think you received this phone call. So accurate, timely, consistent communication reduces fear, but also promotes protective behaviors and promotes an uptake of protective measures that have been given. Poor communication can fuel rumors, panic, and stigma, mistrust within our own system. The media is therefore a critical partner in outbreak control. Every headline, talk show, social media post, and news story can either help stop an outbreak. I don't want to particularly dwell on Ebola only, an outbreak or help to spread it. For example, if in your, like I was saying, in the village, you've gone to maybe pick up a story, some people are falling sick, they've called you, and you find that children are having a rash and a high fever. It could be a possible, what could be a possible measles, it can be a possible outbreak of measles. But if you see that 1, 2, 3 children have the same symptoms, then please report it to the health system. By the way, sometimes we get these notification or alerts from the media. The media can talk about something, and because people do take time and do their research. For example, I was so happy with the gentleman. I think again it was Daily Monitor. He pointed out the fact that currently we have a problem of NCDs in children. NCDs, we are talking about young children having diabetes, young children having hypertension. Why? And he wrote such an amazing story. So that is the power of. So Ebola remains a serious public health threat. Uganda has extensive experience in responding to Ebola outbreak. The government and partners have intensified risk communication and community engagement activities, surveillance and contact tracing, laboratory testing, and case management. And guess what the beauty of such an outbreak also does? Everything has a good and a bad. Is that when such an outbreak comes, we have to test every person. And in doing so, we also realize other outbreaks, other things are happening. Yeah? Therefore, community cooperation remains essential for success. Why you matter? Why, as communicators, you matter during, and why does communication matter during outbreaks? One is that effective communication encourages early reporting. For example, if you talk about all these signs and symptoms and you emphasize to the people, for as long as you feel any of these 2 signs, notify. This is the number that you can notify, and they will come and give you help. It promotes health-seeking behavior, supports contact tracing, and contact tracing. I have a very interesting story about contact tracing. During the Mubende outbreak, I was sent to Kasam. What village or town is 20 kilometers from here? People from Kabale. Katuna border. For example, imagine the community in Katuna has an outbreak. I was posted now to work here. And you tell people, guys, this outbreak is here, let's protect ourselves, these are the measures. And everyone says, you government people, you are just eating your money, just eat your money and go. Isn't it what they always say? You are just wasting our time. You just eat your money and do what? And go. About 4 days later, a young man crosses from Mubende in what we call the epicenter. I take a picture. That's very up close. a young man from Mubende in a place called Madu gets infected. He used to work in the gold mine. So he gets infected, comes back. Gold miners are like fishermen, which are a group of sex workers. Whereas we have our beliefs, we cannot take away cultural beliefs of people. So the guy will go, he came back and says, And then he tells his mother, the mother was a prayer warrior. The mother was a member of the church. So she takes him to the church instead of the hospital. Takes him to the church. The church, the pastor prays, but the guy is dying literally. The pastor reaches a point and says, so they take him to the hospital, a clinic, a private clinic. They take him to a private clinic. In that same private clinic, there was a young man who used to roast meat. I wanted to find the most famous person in the culture, the man of Subosa. Everybody likes him, everyone who passes by, whether you're going to buy or not, you greet him. Yeah? So the young man comes to that same clinic with a toothache. He's attended to by the same health worker who had attended to the other guy who had come with the infection. The health worker thought it was malaria, so he didn't take measures to protect himself. The health worker instead transferred the infection. Now this gentleman didn't get any better. Now the health worker notifies the health system. It's a private clinic, and that's how private clinics work. He notifies and says, we have a patient here who is not doing so well. We come pick him up, samples taken off, turns out positive. Once the health worker heard that this gentleman turned out positive, for him he took a direct drive to Kampala. He went to Mulago and he reported me. I attended to someone, but he has turned out positive. Yet the treatment unit was just in Muwere, but he just decided to try to go to him. The young man was a beloved man. I think, you know how there is always that one person in your community. The old people like him, the young people like him, the children, they all like him. Yeah? Now for us in the ministry, we have an he will go and greet everyone in that building. And then you find him, he just talk. He's a cool guy. So this young man, people come to visit him. And during that time we had said, anybody who feels like they have malaria, please notify us. We shall come and pick you up. It may possibly be EBOLA. And guess what? People say, don't call. Don't call. They will say that you have EBOLA. You just have malaria. So they went to a pharmacy, bring him antimalarials, some paracetamol and what for him, but he wasn't getting any better. 3 days pass. The chairman also comes to check on this guy. He's like, is this guy okay? I've heard he has been ill. So he comes, and fortunately, that's the day that the chairman noticed this guy started breathing. The chairman called us immediately. The chairman called and said, please, we have a suspect here. Please come and pick him up. Our ambulances picked the person up from his home, took him. But he was at that point of bleeding. Like I said, the chances of survival at the point of bleeding are very and extremely low. 2 days later, he passed on. And when he passed on, remember, from the day that we picked him up, the next day, you start immediately what we call contact tracing. We ask who came by, who did you. So if I ask you, you give me another person. I ask you, you give me another person, like that. Yeah? We reach to all these people. Let's say I've talked to him. He says, me, I did not touch him. I just saw him, I did not touch him. Then his friend says, even me, I did not touch him. I was just there. I was like, hey man, guy, you're dying, guy, you're not doing well. So everybody first denied. Fortunately, for us, once the tests came out, and the tests take exactly 24 hours. Within 24 hours, we have the results. Once the results came out, the next day, now that means the second day after it was taken, we had an engagement with the RDC in that same community. And now we are going to tell to the people that, you know, one of us has turned out to be positive. Therefore, let us be vigilant. 20 people. Once they heard that this gentleman turned out positive, 20 of them came. They said, me, I touched him, me, I cleaned him, me, I did what, me, I brought him medicine, me, I did this. He touched me, I cleaned him, I cleaned his vomit. 20 people. Now, in the Ebola outbreak, we do not transport more than one person per ambulance. Fortunately, during that time, the government of Uganda had requested ambulances. I think they were like what, 20, to move to Mubende. 16 of those ambulances came to one area to pick up 16 people at once. 20 people, so they pick up 16. And remember those ambulances, those sometimes you see things are nice here when you're looking at the ambulance on the road, but when it is coming to pick up someone in your area, you first ask, why are they picking him up? Why are they picking him up? All of a sudden, everybody's scared. We pick up the first 16 people, the ambulances come back, pick up the other 4. Now, those were contacts. Before they became, they showed any signs. Everyone in that area, the next day, nobody opened the shop, nobody took their child to school, nobody opened. Nobody even walked around. You could walk around in the canal, in the trading center, and be like, guys, where is everyone? You only see chicken, cats, dogs, what? So you're like, where is everyone? They're like, everyone here has Ebola. Just not even buying something from the shop. The shopkeeper will tell you, if you don't have mobile money, don't give me your money. Just go. Yeah? Then the shopkeepers made it worse. They would, whatever you want, he puts it, packs it very well, ties it on a stick, and gives it to you. And says, you pick it from there. What if I touch you? When you're picking your cabbage, you pick it from there. If not, you will just put it there and say, Now, also the people who are supposed to purchase, they were like, but you have touched my cabbage. What if you? But if you send to me so now they were so scared. Now again, we had to come back to the same community and tell them, guys, come back. This disease is easy to prevent. Just protect yourself, do this, wash your hands, and if you feel in any way that you have fever or headache, just let us know, we shall pick you up. If you don't have the disease, once you're tested, we shall bring you back. That's briefly a small story on how communities also react to communication. And with communication, we were able to bring back the people. But now people are very vigilant. For example, there was a young man, for him that refused to come. He was digging, but started feeling not so well. So he called immediately. He's not feeling well and just coming from my garden. We picked him up. You know how the person is from the garden looks like. The feet are dirty, what not. Just put him in an ambulance, take him to Mubende for care. He turned out to be positive. He was also taken care of. The challenge was that this same gentleman had a child, and remember he was from cleaning the other one's vomiters. And now he carries this child. This child was 3 years old. Just know in one family they lost 7 people. In one family they lost 7 people, including the mother. The father was sharp. The guy, for him, he reported immediately. Once they tested his son and he was positive, he was like, yeah, I'm going. I am going. And the father turned out to be negative. The mother turned out to be positive. But the mother had refused to go. Why? Because, hey, if I leave, who is going to take care of my children? Who is going to do this? Who is going to do that? By the time we picked her up, She was also almost bleeding. She never made it. Have I left out anything? So communication also helps to reduce on misinformation. We are in an era of a lot of information. You're the one who decides what you want to say. A lot. Yeah? For you as journalists, how do you help us in misinformation? Use trusted sources. For example, outbreaks all over the world, there are always two sources. The government, through the particular ministry. For example, there might be an outbreak of a disease in animals. I had in Tunga currently, they don't slaughter meat. There's a quarantine. Yes. You only get information from Ministry of Agriculture or the DVO. For health, you come to the DHO, or you only get information from the Ministry of Health. And those are the trusted sources. Why? Because people are going to spread so many things. I'll still refer to the Mubende outbreak. In Mubende, the reason as to why people had started spreading the misinformation, they said one businessman bought a silo truck, 40 feet, it has 12 tires. They said, this man brought my help. And because he bought this truck, for each tire that is on that car, someone has to die. Those are beliefs of our people. But also, communication helps to protect communities. Misinformation and rumors. For example, Ebola is airborne. Traditional remedies can cure Ebola. Government is hiding information. Anyone from the affected area has Ebola. Rumors spread faster than the viruses if left unaddressed. For example, this particular outbreak in Kampala, some Congolese were evicted. Why? Because they are Congolese, and we had reported that the people who were shot were Congolese. The key principles in outbreak communication. One is that people trust the source before they trust the message. So who are you picking your bite from? That is very important. Who are you picking your bite from? To communicate about a particular disease. Transparency. Share what is known. Unknown what is being done. For as long as it's being communicated by a trusted source. Timeliness. Communicate early and frequently. Accuracy. Verify the facts before you publish. Acknowledge public concerns. There are people, you're going to publish something and people are going to say something about it because they feel a certain way about it. Acknowledge them and be able to respond to them. The role of the media is to provide factual information, explain prevention measures, counter misinformation and rumors, but also to encourage positive action and share official updates and public health guidance. Before publishing, can you ask yourself these questions? Is the information verified? That means, is it coming from a verified source or a trusted source? Is the source credible? Would this create panic? Does it promote stigma? And does this protect public health? There are some headlines that some people publish. Someone says, deadly Ebola sweeps Uganda. Someone says, deadly Ebola sweeps Uganda. Okay? Now, what do you want our international colleagues to do? To say? What do you want our international colleagues to say? Uganda and Congo record 263 cases of Ebola. That was a publication that was given by one of our international colleagues until we had to tell them this. don't forget us, we just have only 3 cases. we are not that extreme. So the 263, only the 3 were Uganda. Were Uganda's cases. Then mystery killer virus spreading through. Yeah? No. Be a bit positive. Health authorities intensify Ebola response. Public is urged to follow Ebola prevention. Surveillance strengthened following new cases. Something that will not create panic in the community. Something that will not create panic in the community. In fighting misinformation, we also look to verify before you amplify. Sometimes you amplify, and you see, social media has 2 things. Is that it can quickly amplify something. And guess what? A bad thing spreads faster than a good thing. Yeah? So you're going to find people are saying this, and that. But it's probably because of social media. So verify which source, who has made mention of this. Is it the Ministry of Health? Accredited health experts? Thank you. When misinformation emerges, detect it, verify the facts, correct it quickly, and also repeat correct information consistently. Why? Why do we say repeat? Because, like I said, a rumor or bad information spreads so fast like a wildfire. But now, for you to also have that kind of reach, you have to repeat it several times for people to actually hear it. We talked about social media. The opportunities, it can help in rapid dissemination of information. And then the reach is so wide. Community engagement. Communities can easily engage on social media. The risks of social media, of course, there is people who, for them, they know everything about the topic. Yeah. Rumors, fake news, misleading videos, unverified health advice. If you remember, when this outbreak had just started, somebody clipped the old communication of Mubende, and then they said, we are going to have a lockdown. Yeah? Remember, fast is not always best. Being accurate is the best. Communicating with empathy. Communicating with empathy. For some people, they get cured of a particular disease and they come back. Avoid what's like Ebola victims, suspected Ebola family. Yeah? Do you know what you've done to that family? Suspected Ebola family. The whole village will ever even accept, even if you have money. No one will ever accept for that family to do what? Can't manage and wait. Some people will say,